If you have been living with persistent shoulder pain, you have likely heard words like impingement, degeneration, or even a rotator cuff tear. These labels can be frightening, often leading people to believe their shoulder is mechanically broken and requires a surgical fix. However, the latest medical evidence has ushered in a profound shift in how we understand and treat the shoulder. Clinicians are moving away from the term shoulder impingement syndrome, which mistakenly suggested that a bone was crushing your tendons every time you moved your arm. Today, we use a more accurate and empowering term, rotator cuff-related shoulder pain, or RCRSP. This change reflects our understanding that your shoulder is not a collection of fragile parts, but a resilient muscle and tendon complex that is capable of incredible adaptation through movement. Drop a comment down below and share your experience of shoulder pain. One of the biggest hurdles in recovery is the fear created by imaging reports from MRIs or ultrasounds. It is a natural reaction to see the word tear and assume it is the sole cause of your pain. But modern science reveals a fascinating imaging paradox. Studies have shown that rotator cuff abnormalities are ubiquitous in people who have no pain at all. In fact, among 80-year-olds with perfectly functioning, pain-free shoulders, over 60% will show a rotator cuff abnormality on a scan. Experts now describe these findings as the grey hair of the shoulder, normal age-related changes that are a part of growing older, rather than a primary source of disability. This is why current guidelines now strongly advise against routine imaging during the initial weeks of treatment, unless there has been a specific trauma or signs of a serious medical condition.
If structural damage is common even in pain-free people, you might wonder why your shoulder actually hurts. The answer often lies in the state of your nervous system through a process called central sensitization. Think of it like a volume knob for pain that has been turned up too high by your brain and spinal cord. In this state, even normal movements that aren't actually harmful can feel painful because the central nervous system is amplifying every signal it receives. Nearly 40% of people with rotator cuff issues experience this sensitivity, which is often driven by factors like stress, poor sleep, or a fear of movement known as kinesiophobia. When we are afraid that moving will cause more damage, we stop using the arm, which actually weakens the muscles and makes the pain cycle worse. Modern rehabilitation is built on the principle that your shoulder is a dynamic biological system that thrives on activity. To help patients understand how we treat this, we often use the donut analogy. If a scan shows a degenerative area or a tear, that is the hole in the middle of the donut. While we might not be able to fix that specific spot, we can make the healthy surrounding tissue, the donut itself, stronger and more resilient. The gold standard treatment for this condition is a graduated exercise program lasting at least 12 weeks. This process, called progressive loading, involves gradually increasing the resistance your shoulder can handle to build its capacity. While exercises can sometimes provoke a mild level of discomfort, the latest research confirms that short-term discomfort often leads to much better long-term benefits.
You may still be wondering if surgery is eventually inevitable to repair the tear. Surprisingly, long-term studies following patients for over 10 years have found that 75% of people with full-thickness rotator cuff tears can be successfully managed without surgery. Those who chose exercise over surgery often reported a higher quality of life a decade later, suggesting that skipping the operating room does not compromise your long-term health or function. Recovery is a partnership between you and your clinical team through shared decision-making. By focusing on movement and education rather than scary labels, you can reclaim your active life. Your shoulder is strong, it is adaptable, and it is ready to get back to work.